Doctors from the Charlotte area hoping to reassure parents after a TB case was reported at a North Mecklenburg High School. WCNC Charlotte's Destiny Richards now live here in the studio. She has more from a Novant Health infectious disease doctor on how families can stay safe. Destiny?
Yeah, we know that as local health officials continue monitoring a case of tuberculosis at North Meck High School, they say there's no need for widespread concern, but they do want families to know the signs. CMS confirmed the case earlier this week, but hasn't said whether the person who tested positive is a student or staff member. The district says only those with potential exposure will receive notification letters and testing recommendations. Mecklenburg County health officials are now working with the school to track and limit any possible spread. Doctors say TB is an infection that mainly affects the lungs and can spread through the air. Common symptoms include a persistent cough, fever, fatigue, and in some cases coughing up mucus or blood. But sometimes the infection shows up without any symptoms at all.
Individual who has latent TB, so they don't have any symptoms, they're identified through a blood test or a skin test. If you have active tuberculosis, you're identified often through coughing up some sputum from your lungs that can be sent to a laboratory that can look for the germ. Blood tests and skin tests are also used, as well as chest x-rays for those individuals to determine that they have active TB and therefore could be contagious to other people.
Doctors say there's no vaccine for TB in the U.S., but it is treatable with prescription medication. Anyone who thinks they may have been exposed is urged to contact their healthcare provider or the Mecklenburg County Health Department. Lisa.
I'll take it, Destiny. What steps the district, what is it taking right now to keep students and staff safe?
Yeah, it's similar to with the cold or flu, right? CMS says classrooms and common areas at North Meck High are being deep cleaned, and staff are encouraging hand washing and good hygiene practices. So it is similar to a response with the cold and the flu. It is spread through the air, but it's not as contagious.
All right, good to keep in mind. Destiny, thank you for that.